Oke. Sorry, bentar. Oke, kita mulai ya. Bismillahirrahmanirrahim. Tanda. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, before it, I would like to say thank you to you all for coming in our presentation. Let me introduce myself first. My name is Fernanda Chairunisa and also my team, Hawa Anggita Widya Rahman from Department of Animal Production, Faculty Animal Science, Brawijaya University, and Lutfi Abdullah from Department Biomedical Science, National University of Singapore, and I'm from Department of Biochemistry, IPB University. In this opportunity, I am Fernanda Chairunisa. As a presenter from my team, I would like to present to you all our research that we have done entitled BACOON, Bowls of Cocoon for Malnutrition Preventive Medical Food at Kandang Sapi Village, Cianjur, Regency, West Java Province, Indonesia. Indonesia is currently experiencing health problems of malnutrition, especially in children regions in Indonesia, are very vulnerable to high rates of malnutrition due to lack of access to adequate food. Cianjur Regency is one of the areas in West Java province that have an issue of nutrition problems. As we can see from the bar chart at left side, the biggest issue in Cianjur is underweight, then followed by wasting, obese children, and obesity. Malnutrition is described as a nutritional imbalance in the human body as a result of an inadequate supply of nutritious food, nutritional deficiency resulting from an unbalanced diet in children can lead to disease, weight loss, and even death. Malnutrition is a serious problem that accounts for 45% of the causes of death in children. Okay, okay. Lack of nutrition, especially energy and protein intake for children, triggers children's malnutrition. Prevention of malnutrition is carried out by fulfilling nutrition by supplying foods that are formulated to support the fulfillment of individual nutrition in accordance with the physiological needs or called medical food. And bacon snacks in a food that is formulated with the main ingredient cocoon and additional ingredients, namely bags, so that it can meet the protein intake and energy intake in children. From this background, we have the aim to overcome the prevention of malnutrition in children through bacon snack food, especially in Kandang Sapi village, Cianjur. The method that we have done in the first is the first of all. We did a literature study and material. After that, we formulated the bacon snack based on ingredient that we accumulated from literature. Next, we did the quantitative approach by analyzing the content of the bacon snack, which is carried out in the laboratory through a macronutrient content test through the proximity analysis and analyze the amino acid content in haplolysis method. After that, we did in vivo analysis through the blood of mice. Finally, we produced bacon and introduced it, then observed the changes in the growth and development of children's, totaling 20 children with description of the sex of 10 children were female and 10 children who were male in Kandang Sapi. The result from our research showed why bacon is a good medical food for malnutrition. Bacon snack is a food that is formulated with the main ingredient cocoon and additional ingredients, potatoes, so that it can meet protein and energy intake in children. Based on proximate analysis, the bacon contains 50% protein and 40% carbohydrates. As the highest macronutrient, protein become the main content of bacon snacks, and we know that this protein is the one essential macronutrient for human growth and development, which is composed from several amino acids, and one of them is essential amino acid that cannot be synthesized by humans, but is important for our body. In the study, testing for the presence of essential amino acid was obtained from analyzing using the HPLC method by producing several important amino acids. Serine, cysteine, and valine are the most abundant amino acids contained in bacon snacks, with presence of 20%. Other amino acids that followed were glutathione by 15%, lysine and valine by 10%, and last is lysine by 5%. And the main amino acid of bacon is sericin. The, the biomedical application of sericin is a proof that bacon is a good medical food for malnutrition sufferers, which is closely related to its best function as an antioxidant food with function that can inhibit the occurrence of lipid peroxidation that it can reduce the risk of cardiovascular, hypertension, diabetes, and hyperlipidemia. Bacon is also owned by tryptophan, which is an essential amino acid that plays an important role in the regulation of various physiological mechanisms, a precursor for the neurotransmitter serotonin and the niacin vitamin. And last is the cysteine, which plays an important role in providing anti-hypersensitive effect through the storage from the glutathione to reduce oxidative stress, improve insulin sensitivity, and glucose metabolism. Based on the anthropometric measurements and development of men and women are measured through the parameters of height, weight, and waist circumference, which refers to the regulation of the Ministry of Health. Data on the body changes for both men and women have increased number after consuming bacon for 6 months and shown in the table below, so that we can conclude that malnutrition cases for children can be done with the prevention through medical food that can supply nutrition according to the body's physiology, and Pakistan become the solution to prevent the issue of malnutrition, especially for children in Kandang Sapi village, Cianjur, Regency. Okay, thank you for the attention. Assalamualaikum warahmatullahi wabarakatuh.